Good afternoon, and welcome to our Lunch and Learn series today from OPEA. We're going to be talking a little bit about emergency transportation issues in Oklahoma. Also, Chanson is going to bring to us today the 201 part, the advanced advocacy conversation, especially as we're in legislative season, getting ready to roll into primary season. My name is John Green with Association Member Benefits Advisors. Just a little bit of housekeeping for those of you on the call today. All participants are in a listen-only mode. And what that means is if you want to communicate, feel free to drop it into chat and Q&A. Tony and David and Chanson and myself will monitor that periodically. If there's something specific that applies, we'll maybe stop and have that conversation. If not, we may just respond to you directly over chat. So feel free to do that. You'll also notice the QR code there in the bottom right-hand corner. We'll talk about that as we go throughout here. If you're joining us and you have access to your smartphone, you can open up your camera feature on your smartphone, hover over that QR code, and ask questions, seek information about things we talk about today. So before we jump on into our conversation today, I want to turn it over to Chanson Flick, who is your government relations coordinator. And Chanson, tell us, talk to us, extend that conversation on advocacy as we're going more into the bill portion of the legislative session.
Absolutely. And thank you, John. So yeah, as we are kind of moving into, we are now in our, I want to say the third week of the legislative session right now. Actually learning how to advocate is a very, very important aspect of where we are going forward and how to go ahead and advance the issues that's going to improve your employment. So as John had already mentioned, the last time we did one of these lunch and learns, we'd done the 101, kind of the basics on advocacy, and we're going to kind of dive a little bit deeper here on things that you might be able to do if you want to go ahead and advance a little bit further as far as being a advocate for your profession and for public policy. So the first thing that you can honestly do is join your professional association. Regardless of whether you're a state employee, a teacher, a laborer, there is a professional association out there that is going to represent you going forward as far as making sure that your interests in public policy are going forward. For state employees, that's going to be OPEA. We are the association that's going to be representing you. We cover every state employee outside of directly classroom teachers. So if you are interested in joining and advancing your profession, please join OPEA as soon as you can. Now, specifically, depending on where you're working, there may be some very specific duty-specific organizations, such as one of our partner organizations we work with is the Oklahoma Court Reporters Association. They have their own organization, and I'm going to be kind of talking about some of the advocacy that they have done this week a little bit later on. So next move is, and I mentioned this last week or the last time we done one of these, but it's still very important, is to know your decision makers. Every single person in the state is going to have one representative in the State House of Representatives and one state senator, as well as the governor. Those are your three big ones that you need to know as far as the folks that are making decisions on your behalf at work. So if you have any trouble with that, please contact us at any time. I will be more than glad to help you figure out who is representing you and who you need to be reaching out to as far as whenever we're advancing legislation and we're asking you to reach out to somebody to advance a bill. Do want to mention that due to the census this year, we redistrict every 12 years or every 10 years. So this year is going to be a redistricting year. So come next election cycle in November, you may have a new rep or a new senator, depending on where you live. So that's going to be something to keep an eye out for, and we'll be more than glad to help you find those people out. So as far as once you know who those people are, you've got to make it personal. You need to build a relationship with your rep, with your senator. And it's a little more difficult with the governor's office, but still, as long as you are reaching out, they are going to be reaching back to you at some point. But make those relationships personal. They are going to start depending on you, on being the expert in your particular job area. Lawmakers have to cover every aspect of state policy. So they may not know specifically what's going on within the Department of Corrections or within DHS or within any varying state agency. So it's important that once you establish those relationships, that they know that I am an employee of this agency, and if you have questions, you can come to me. I mean, nobody's going to know the work that you're doing better than yourself. And if you can go ahead and express that to these legislators, they will come to rely on you as the experts that they need. And that allows you to influence policy. So you got to be a resource for these people. Whenever they have questions on any particular issue, I got a question from a rep here in Oklahoma City this week in regards to a specific issue that was dealing with OJA. And I can go ahead and tell him kind of the bare bones aspect of everything. But until he gets one of his constituents telling him these answers directly, that's how you go ahead and become that expert, and you influence the decisions that they are making. The last item I want to mention on influencing policy is you've got to make your issue the hot issue. One of my favorite organizing quotes of all time has been, no politician can sit on a particular issue if you make it hot enough. Eventually, they got to move on it. And that's what you do. As long as you will keep contacting them, keep bringing up your issue over and over and over again, they will act on it. So that's the important thing about that. So what are some other areas that you can actually work on as far as getting directly into advocacy? The first thing, last week, or the last time we met, we talked directly about, getting involved on trying to move bills back and forth. What you can do in the long term, the biggest thing you can do is campaigning. So now that we're dealing with redistricting, it's very important, because we're coming up on an election cycle in November, is to understand which legislative districts you live in and who is running in those districts. Who is going to be the folks that are running for your state rep or your state senator. Understand who they are, understand what issues they stand for. And whenever we get to the end of this, I'll tell you a little bit more about how OPEA can help you make some of those decisions. But once you kind of figure out who you want to work for, some of your options are get in touch with the candidate and ask them, can I do some door-to-door campaigning? Can I walk up and down my neighborhood, talk to my neighbors, and tell them, hey, I need you to vote for this particular person? Another big one that they actually work on is phone banks. This is a situation where they will go ahead and try to call everybody in a particular legislative district and say, hey, here's the issues we're working on. We want to ask for your vote. The next one would be events. Candidates host events very often, and it's a great opportunity to get a group of people together to hear a candidate, hear their issues, and ask them questions. If the particular candidate that you are dealing with is somebody you strongly support or somebody you even strongly question, offer to go ahead and host an event if you don't see any going on, and have them come in and be honest and actually receive questions and, figure out where they're leaning as far as public policy goes. Now, the next option, and we haven't done this as often as we would really have liked, just because of the way state employment goes, is doing lobby days at the Capitol. I'd mentioned earlier, the legislative session runs from the first Monday in February to the last Friday in May. So in between, at any given time, the OPEA lobbying team is over at the Capitol trying to advance legislation that's going to try to make your lives a little bit easier. If you feel like any of our legislation or a bill in particular that relates to your agency is something you want to work for, you can take a day off and go ahead and contact OPEA, and we will be more than glad to go ahead and help you coordinate on moving your people in there, meeting with the right targeted people, and advancing your legislation through some direct face-to-face advocacy. I had mentioned the Oklahoma Court Reporters Association, OCRA right here. They had just came in this Monday and did a lobby day with just their people, and we managed to go ahead and advance a bill that's related to their compensation directly out of the subcommittee and into the full committee, and we got a lot of further discussion with everything going forward that I think is going to really help advance that legislation going forward. So the next step that you can do as far as direct advocacy is recruitment. the first thing that you can do, as I mentioned earlier, is, as we are a professional association, recruit more people into our association. The more people that we have, the easier our advocacy becomes, because we can go ahead and say, if we have a workforce of 40,000 people and we are representing 30,000 of them, it's very easy to go ahead and have a lot of sway whenever we're making to the people that are making decisions. If you are an OPEA member and you want to kind of deepen your own personal advocacy directly in your office, please contact us about becoming a worksite representative. These people are the frontline workers that we depend upon, that we will go ahead and give you some open access to what's going on first at OPEA, what legislation needs to be going forward, when to contact. And you are also our point of contact whenever we understand that there's issues going on at your workplace. So it kind of gives you a chance to advocate at the state level and at your worksite level. On a separate note, as far as recruitment goes, if you are going to be campaigning and you're working for candidates, talk to your neighbors, talk to your friends, talk to your local community leaders, and advocate for the candidates that are going to be best for your specific needs right there. Specifically within OPEA, we usually put out a list of our recommended candidates. Talk to your local community leaders about seeing if you can go ahead and make sure that they are backing these candidates going forward. The last one I want to mention on this slide is, maybe there's not a particular candidate in your legislative district or your local district, for even so far down a school board, that is not representing your interest. Consider yourself, I mean, this is a democracy, we're wide open. Consider running for office. So if you're looking at the legislative level, the House of Representatives, those seats are open every 2 years. And they run on a 2-year cycle. So if you do not see somebody running for the House of Representatives in your area that fits your needs or your wants or policy needs, consider giving that a run. The Senate runs a little bit differently. They are on 4-year cycles. So only half of them are up every other year because they split that. The odd number runs on, the odd districts run on a certain election year, and the evens run on the other 2-year cycle. So running for Senate is also an option as well. So John, if you can roll me over to the next one. So if you have any questions about any of this, and especially as far as contacting your legislators, figure out their preferred contact method: email, call, text, in person. Once you actually start meeting with these people and starting these conversations, they can tell you the best way to contact them. And then just be persistent. Monitor what they're doing, monitor any legislation that's going forward. If you have questions about a particular bill or a particular legislator voting a certain direction, contact our office, contact myself. All my contact information's here, my email. Please just reach out to us. I'll be more than glad to help you get in touch with the right people. And the last thing I wanted to mention on this, as far as getting involved in deepening your advocacy, is the Oklahoma Public Employees Political Action Committee. No, with your due dollars, nothing goes towards any political action unless you are voluntarily donating into the PAC, the Political Action Committee. So once you actually start doing that, you actually have a voice on deciding who we endorse, on who is going to be receiving funds that we use to support political candidates that support state employees. So these are very small contributions. They also are tied into your dues, so it doesn't take a whole lot of time. If you want to go ahead and dial it in on that, you can set in on these interview committees that we do with candidates. With sitting legislators, we judge off their voting record. With new folks, we actually do a sit-down interview. Sometimes it's through Zoom, sometimes we actually try to meet face-to-face, and we have conversations on OPEA issues and how these candidates would, if they were to be elected, how they would behave. So if you have any questions about if you are donating to PAC or not, or if you'd like to go ahead and, if you're already a member and would like to donate to PAC, you can contact Candace Steele. I've listed her email down here at the bottom. And we would love to go ahead and give you any more information that we can give you on that. So that's kind of the end of my whole bit right there. So John, if
Chancellor,
Tony
I
has
do have a
any
question before we move forward. When you interview these candidates, I know OPEA doesn't pick a side. So tell me about that nonpartisan process.
we are completely nonpartisan. We don't care if you're Democrat, Republican, Independent, or Rastafarian. We really do not care, so long as you have a set public policy that is going to be supporting state employment and core services. So outside of that day, we really do not care about your political alignment.
Great. Thank you very much. I appreciate it. I've learned a lot in the past 2 sessions. For those of you who are on this call, we are recording this webinar. We'll have it posted out on the OPEA website very soon so that you can follow up with email addresses, things like that. If you've got specific questions, drop them into chat, put them into the Q&A. Tony and Chanson can follow up on those. And at the end, if there's something that pops in that maybe the whole group needs to know, then we'll address that as well. So thank you both very much for what you're doing for us. Just a quick reminder, my name is John Green with Association Member Benefits Advisors. I live a little bit further south in Houston. With my family, we are active in public education. My wife is a teacher. I used to be in the schoolhouse helping educators understand what their retirement benefits were going to be. My family all started in Texas public service. My father, my mother, my grandfather, my aunt, all worked for the Texas Highway Department throughout their career. Some of them retired from that. So I appreciate what you do on behalf of our state employees. As Chanton mentioned, OPEA serves many different purposes. One, to make sure that your pension, your pay, your health benefits, those type of things, and raises and issues that are so vital to you, stay on the forefront, stay on the front burner for those legislators that are out there working on your behalf. And also keeping you connected. Oftentimes we get so siloed in our departments or in certain parts of the state. OPEA does a great job of keeping you connected across the state so that you can find what like members are doing on your behalf as well. And then they partner with folks like us at AMBA to make sure that your benefits, your discounts, all these fun things that come outside of your job are there for you as well. So we're going to talk about that in just a moment. Just a quick reminder, we're relatively new in our relationship with OPEA, but AMBA has been around for 40 plus years. We serve public service associations. So think just like yourself, active and retired state employees, active and retired educators all across the country. David Moritz is our leader in Edmond, Oklahoma. He and his team are scattered throughout the state. They can help you with any questions you have about becoming a member of OPEA and how to take advantage of the benefits that you have and how they work with what your state benefits are, because there are certain gaps that your state benefits don't cover. You have some decent benefits with a lot of options, but as we've shown in the past, there are some things out there that you could be missing that could put you at a financial lurch if something happened to you. So we're going to talk a little bit about some of those benefits. We're going to talk specifically today about the emergency transportation issues in the state of Oklahoma and how that impacts you. Members of OPEA benefit from having a relationship with AMBA because it helps fill those gaps that aren't covered by your state benefits. They're portable if you leave the state for whatever reason. So if you leave employment with the state, if you move out of state, go to the private sector, whatever you do, you can take these benefits that you have with OPEA with you. But OPEA members tell us they appreciate the ability to have benefits for their family members that maybe the state doesn't cover because they aged out, adult children, or they have parents who were never eligible for their benefits. And because the benefits that they can get through OPEA for their parents, it may prevent you as a state employee from having to take extended time off to spend with a loved one and run out of your PTO or your leave time if you do some proper planning there. As I mentioned, we're going to talk today about the emergency medical transportation issues in the state. And we're going to do this in a little stair-step approach. We're going to talk about the golden hour and address what that is, kind of identify the specific issues in the state of Oklahoma. And we're going to do that through locating where those trauma centers are, where people get care taken care of. And we're going to kind of go through what insurance and Medicare cover and don't cover. That way that you understand where those gaps are if you do need to take an ambulance ride to a hospital air ambulance rides, something like that, how to have that peace of mind. We're going to touch real briefly on EMSA in Oklahoma, because we do get a lot of questions about that as far as emergency medical transportation. And then at the end, we're going to change to something a little bit more fun and talk about the spring break discounts. I promise you, at some point, the sleet will stop and it will get warmer and you'll want to go somewhere for spring break with your kids. There's some new discounts that are out there. I'm going to show you that and make sure that you understand what we have available to you as well. So let's jump right in. The golden hour is a concept that was coined by Dr. R. Adams Crowley. He is a teaching doctor up in the Northeast at a teaching hospital. And people think that the source of this really came from the World War I battlefields in France, but it's that hour immediately following some type of traumatic incident, an accident, a stroke, a heart attack, that if you receive medical treatment, it can prevent irreversible medical damage and optimize your chance of survival the most. And so as a result, ambulance services, air ambulance services, hospitals have improved their medical emergency response teams to help improve that survivability and the medical improvement of patients within that golden hour. And because of that, you see many more ambulance services, many more air ambulance services, but the cost for that is quite expensive. So I kind of pulled up some things in Oklahoma and looked around at the websites for the TV and radio, pulled some newspaper ads, things like that. These are live headlines or actual headlines that I took out of some of the papers that talk about the ambulance cost going up, up, and up, and the cost for transportation for just a short air flight or for just a quick drive into a hospital on an ambulance can be in the thousands of dollars. And certain counties are having to raise their rates because they're not covering the cost. Then on top of that, you start to have inflation. You start to have shortages for personnel. Costs go up as well. In Oklahoma, we're seeing this to become an acute situation. Department of Health and Human Services says that well over half of individuals who need an ambulance ride are female. And the top 5 reasons that we need emergency transportation, number 1 is heart attack and stroke. Second is an accident, whether it could be a car accident, a work-related accident. Then you get neurological disorders. Then you have respiratory distress. And this moved kind of up the charts with COVID, pneumonia, things like that. And then this time of year, when we're thinking about ice, slip and falls. Those are some of the top 5 reasons that people have to have emergency transportation. And when I'm talking about emergency transportation, I'm talking about ground ambulance, helicopter, life flight, and airplane transportation as well, because sometimes people need that depending upon where they are or the speed in which they need to get to a major trauma center. And when we talk about trauma centers are classified in 4 different classifications. Level 1 being the best of all the best trauma centers, meaning that it has 24-hour specialists, 24-hour equipment. Usually these are teaching hospitals. They have all the different types of equipment and specialists on hand that are available to use all the time. Then as you go down the scale, level 2 may have the same equipment as a level 1 trauma center, but maybe not have all the specialists or some of the post-care treatment that's available out there. Level 3 and level 4, you get down to what I call a doc in the box. They're really designed just to maybe stabilize you to then get you transferred to a level 2 or level 1 trauma hospital. So what happens is, especially in Oklahoma and down here in Texas where I live, the further you live away from a hospital that's a level 1 or level 2 trauma hospital, the more expensive those transportation costs become and the less that insurance will cover. And I want to kind of go through that and kind of walk you through some examples of that as well. Well, let's take a look at Oklahoma. There are 109 trauma centers in the state of Oklahoma. Several counties have no hospital. So when I say trauma center, we're talking about really a true doc in the box that may be open certain hours, but not 24 hours. Then you narrow it down a little bit. You have 2 level 2 trauma centers in the state and 1 level 1 trauma center in the state. So what that means is if you live, the further out you live from those, that may mean an ambulance ride into a local trauma center, doc in the box, and then an air flight in to a level 2 or level 1 trauma center, add in the expense on top of that. And so It can be quite expensive the further you are out in the state, but it does present some problems for those of us who live in rural areas. And people will think, well, I've got coverage through the state, or for our retirees, I've got Medicare coverage as well. What usually happens is that the commercial policy, when I say commercial policy, what the state provides for you, or maybe you get through your spouse, but not Medicare, not a government, federal government plan, but a commercial policy will only pay for usual and customary charges. And I'll show you that in a moment. They have a fee schedule in there that says we will pay this amount for transportation coming in. The problem is most transport is either provided by a different or governmental organization, or an organization or a company that is not participating in a network, whether it be into any type of Medicare Advantage network, any type of hospital insurance network. So they're fixed fees. The ambulance service may charge above that. Medicare language on top of that, for those who are on Medicare, whether it be for yourself or for your parents, can be very tricky. They have a pretty tight pay schedule as well. And oftentimes they won't pay if they don't deem the transportation to be necessary. Now, let me give you a personal example of myself. This is not a Medicare example, but this was an insurance example. My middle son played football all through elementary school, through high school, into college. And when he was about 10 years old, I saw him on the field, totally motionless, knocked out. All I could hear was him crying. We got out there to tend to him. Here, an ambulance pulls up about 5 minutes later. They strap him down to a gurney, haul him off to a hospital about 5 miles away. We didn't have a choice to call the ambulance. We didn't have a choice of the hospital they took him to. Come to find out, thank goodness, he only had severe cramps. They did some IV fluids, Gatorade. He was good to go. We get the bill back from the insurance company that says he was not medically necessary for him to travel in an ambulance to the hospital. You're responsible for it 100%. So you find out that your neighbor, take this to yourself, you slip and fall in the front yard, or that your neighbor finds you passed out in the front yard and they call an ambulance. If the hospital, or excuse me, if the insurance company or Medicare decides that it is not something that was medically necessary, you could have been transported by a car or an Uber, they won't pay for it at all. So the reality is, even with insurance, you have an expense exposure to emergency medical transportation, and especially in Oklahoma with the way that some of the emergency transportation is set up here. Here's an example for your parents or yourself that may be on Medicare. Medicare loves to put in qualifying language, what I call. So I've highlighted, they may pay for, or they may pay for something if the doctor says you need to be transported to another hospital. And then if you don't have a supplement or don't have something else that pays for it, you're responsible for any amount over the Medicare paid amount, plus the deductible, those type of things. So it said, even if you have Medicare, there are expenses for transportation. And Medicare and some healthcare plans for state employees will only pay for certain type of treatment while you're in transit. Okay. So think about this. You're in an ambulance. You may or may not know, are you a paramedic? Are you an EMT? Is this treatment that I'm getting treated for, is it covered or not? There's two different types of treatment when you're being transported either in an air ambulance or on a ground ambulance. Basic life support, an EMT provides this, CPR, oxygen administration, checking your vitals, bandaging you up, splinting, that type of thing if there's a broken bone. Then you get into advanced life support, especially if you're in an air ambulance or in longer situations where you may have a paramedic that's involved that does EKG monitoring, chest defibrillation, fluids, things like that. Medicare and certain private insurance does not pay for advanced life support. Well, you don't have that choice whether you get that or not. So I'm going to show you a bill here in a moment that shows what the cost was just for the transportation, and then the cost for all those things behind it. And if the insurance doesn't pay for that, we're responsible for it. You're responsible for that expense, and it could put you at a financial lurch there. And while you can't prevent those bad things from happening, you can't prevent those slip and falls, that heart attack, that accident maybe that you were in, you can only be prepared when you do. And this is where OPEA has stepped up, and with AMBA's help, to try to find solutions for you. And I'll show you those solutions in a moment, but I want to kind of show you those bills first. This is an example of a real medical situation where somebody was transported only 20 miles. You can see the cost just to dispatch the ambulance. The ground ambulance was about $1,300. 20 miles, they had a mileage charge on top of that. Just for that transportation was $1,700 total. Insurance only picked up, because they have a usual and customary charge, about $375, left the patient, the person who was transported, over $1,300 bill they were responsible for. Narrow that down only 9 miles. So I mean, very close if you're close to a hospital. Same situation, $1,400 worth of bills, $400 worth of payment, depending upon the company, still $1,000 out of your pocket that you're responsible for. So there are some situations where you're going to be on the lurch for that. Going just 4 miles, so even closer to home. I live where I can get on my back porch and I can see 2 hospitals away, about 4 miles to get there, but I can see those hospitals. Transported 4 miles, you see it's $16 a mile plus the ambulance, $1,300. So it doesn't matter if you're transported 4 miles, 400 miles, it can be expensive. In rural Oklahoma, just like here in rural Texas, and just like I see over here, I see the Life Flight helicopters land all day long at the hospital across the freeway from me. Just starting up an air ambulance is an expensive cost. You see this down here, this is an individual out in California, $33,000 just to turn that helicopter on, $296 a mile to fly that. Then, as I mentioned, all of those treatments that take place in that air ambulance, that helicopter, all of those things have a cost on top of that. Most of your air ambulances are operated by a hospital or by a private company. In those situations, they don't participate in any network. They're there to turn a profit for the hospital or for that private entity. That expense is pretty substantial. Even in this case, when the hospital, excuse me, not the hospital, but the insurance company paid $33,000 for this bill, the patient was left on the hook for $8,300. So that transportation cost can get up there quite a bit and can be quite scary. This is where OREA and OPEA have stepped up to provide you with a company called MASA. MASA is a company that provides not only some transportation, but they reimburse you for transportation expenses that are out there. They've been around for 47 plus years. Over 2 million active members are involved with MASA or members of MASA. They enjoy a very good rating by the Better Business Bureau. In parts of the world and parts of the country where there are not ambulance services, they have skilled nurses, paramedics, physicians, planes, things like that that can take care of you. In the areas to where you do have services, they will reimburse the cost for that. You have no dollar limit, meaning that you are protected 100% for any emergency transportation costs. So that's not something you have to spend out of your pocket. You don't have to worry about insurance haggling, things like that. Here are a couple examples. This is a situation to where, say you're living in Norman and you're 15 minutes away or 15 miles away from the hospital, but there's traffic. This is a member that lived in the suburb of Fort Worth, wasn't too far away from the hospital, but was having a stroke. Rush hour traffic would have taken them over an hour to get there, might have lost her husband. So they dispatched a helicopter. Helicopter came, picked her husband up, landed out in the front yard in the street, took him to the hospital. He was taken care of, safe, got the life-saving treatment that he needed right away. That bill was close to $25,000, and MASA paid 100% of that bill. Again, peace of mind, knowing that you're taken care of regardless of what the health situation and the transportation cost. Here's an example of a member, a retired educator from Colorado that was traveling. Now that that COVID is kind of slowing down, people are traveling more. She was out traveling in Mexico on those pyramids that are down there. She fell and broke her leg. Not only was she out of the country, the hospital that she went to wasn't the best and couldn't get her leg set. She was at danger of losing the ability to walk or maybe even losing her leg. MASA dispatched an air ambulance to go pick her up, get her back to the States as quickly as possible. Not only did they cover the cost, the speed in which they got there and got her back allowed her to maintain her mobility and allow her to travel again. And they took care of that 100%. So it's not just covering the cost. Sometimes it's speed getting you to the States and getting you taken care of. So there's a lot of options. So what does exactly MASA do? MASA is a membership service. It is a supplement to any insurance coverage that you have. It gives you financial protection for all those life-saving emergency transportation issues 100% of the time, whether you're at home and you slip and fall going out to get the mail today, or whether you're halfway across the world on a cruise, on a family vacation, or something like that. They will pay for your expenses related to emergency transportation 100% anywhere that you are, giving you that peace of mind. We talked about the emergency air transportation, just like that teacher down in Mexico. They also cover air ambulance helicopters. When I would travel to see my middle son in Missouri and flying to Kansas City, go over to Columbia, about every 30 miles, there's a helipad in an open cornfield out there. They pay for all those helicopter transport. Ground ambulance transportation, which most people use that. Repatriation, meaning bringing you back from out of state, out of country, back to home. So you go with your kids down to Florida and something happens down there and you have to fly back. They'll pay to transport your minor children or your grandchildren back. They'll pay to return your vehicle if you drove to a national park, drove to Branson, something like that, to come back. We've had situations to where members have been in a foreign country and a spouse pass away. They will fly the body back, the remains back. Organ transplants if necessary. All of that anywhere in the world, 100% covered. There's no cost to you out of your pocket. There are some benefits as well that are exclusively for OPEA members. I'll share with you those in a moment, but it is something that gives you peace of mind. If you travel with your family, if your parents are traveling somewhere and they're doing a lot of travel, to know that they can get taken care of and get back safely with no expense out of their pocket as well. Now, there are several different membership types. There's a monthly membership that you can get that costs less than a cup of coffee. Now, when I did this presentation here last year, had some member go, holy cow, I spend $6 for my half calf decaf foam latte or whatever you got at Starbucks. I'm talking about a cup of coffee at 7-Eleven. We're talking less than 75 cents a day, can cover you a little bit more for a family. Very inexpensive to have this peace of mind. There are some 5-year and lifetime memberships that allow you to cover family as well as yourself for a certain period of time or for the rest of your life. When you get that, you also get this My ID bracelet. Some people don't want to wear a bracelet. They can take the little clip off and put it on their Apple Watch, something like that. But it helps you, and David and his team will help you do this. Put in all of your medical information. If you have any allergies, pre-existing conditions, things like that, who to contact if something happens to me, who my doctor is. And paramedics are trained to look for these things so they can scan them, already have your information and communicate it en route to the hospital, or be able to provide that life-saving medication for you in the ambulance. 24 hours a day, 7 days a week, live people on the other end of the line, helping the paramedics out to understand that. This comes free to you as part of the 5-year lifetime membership. Now, you get this coverage as a member at home, slip and falls, heart attack, something like that, anywhere in the country, anywhere across the world, ground or air, it doesn't matter. They'll get you back home for whatever. You can purchase this coverage or this membership on the open market. You can go to MASA and purchase it right on the open market. For OREA members, OPEA members, members in the state of Oklahoma of either association, members get a 40% discount off the list price. And David is waiving the membership fee. So if you just walked in off the street, went on their website and bought it, you're going to pay about 40% more, and you're going to have a $60 membership fee. David will waive that membership fee. That pays for a significant portion of your OPEA dues, and you get the discount on top of that. And then additionally, as OPEA members, you don't have any claim paperwork that you've got to file. 24/7, you can call them and tell them, hey, I'm going on a cruise to the Bahamas next week. They can say, all right, we'll make sure we've got medical transportation down there in the Bahamas ready if something happens to you. 24/7, you can let them know. No claims paperwork you've got to mess with. Simply send in the bill. They pay it 100%. So it's very simple and easy. And MASA can take care of all of those issues for you. Now, if you've got questions about MASA, drop them in chat, put them in the Q&A feature. We'll come back and cover that in just a moment. I want to talk real briefly about EMSA care, because some of you have EMSA care. You pay a few cents every month on your water bill, I think it is. EMSA care really is limited to just about 12 cities in Oklahoma. So it doesn't have broad coverage area. So you're not talking worldwide or even all across the state of Oklahoma. And it is limited just to ground ambulance service that you have that ability. So people that have it, I'd say continue it. It supports your local care provider, but putting MASA on top of that will make sure you have no bills out of your pocket. And then if you go outside of EMSA's coverage area, you've got complete coverage anywhere in the world out there as well. So any questions, drop that in the chat in there. Let's spend just a few minutes before we wrap up here and talk about some of the discounts that are out there that are new for you. Spring break is coming, but if you're still locked at home, there are lots of new discounts through the Passport program. This Passport program is a free discount program to you as OPEA members. David and his team can help you with the activation code to get set up for that. It's another way to make your paycheck stretch further, your pension check stretch further, saving money on clothes and houseware. There's a lot of things out there that are available to you this time of year. A lot of these companies are doing spring sales, discounts out there for you for in that. There are hot deals that are out there. If you're looking for Apple products, HP products, whether it be phones, watches, iPads, things like that, significant discounts, hot deals that are available for you out there. Lots of food and wine options. There are some local ones in the state of Oklahoma. More and more companies are signing on to take advantage of the membership discounts that are available out there. So take advantage of it on your side. Put a cork in it. Theory Coffee House, you get 15% off coffee and wine. So save yourself money right there. So many more local restaurants are coming in all across the state. You can go out to the Passport website, plug in your city, zip code, wherever you are. You can see what restaurants are out there. Some offer discounts specifically. Some offer discounts off of gift cards. So just a great way. Lots of restaurants that are out there that are available that are new for you as well. Travel season is heating up. If you're thinking about going out to Vegas at spring break with your wife, if you're thinking about going to Florida, down to Six Flags in Texas, Frontier City when it opens up, you're going to find these discounts all on the Passport website. Save a significant amount of money on tickets, hotels. Great Wolf Lodge down in Grapevine, down in Dallas area, significant amount off. The Airbnb equivalent is called Haven, HVN. So if you're looking to rent a home or a condo, something bigger for the family in different places, go out there. Extended Stay America, the Wyndham products, Days Inn, Wyndham Hotel Chain, that type of stuff, discounts, rent cars. So many discounts are out there. More and more are being added every day in Oklahoma, all across the world as well. So a significant amount of opportunity that's for you out there. Again, if you've got questions, David and his team can help you out. We are moving into March. We've got a couple of sessions coming up. It's on the 10th and the 24th. We're going to tackle the basics of long-term care. Your state employment does not offer any type of long-term care benefits. And so we're going to talk about that. We're going to talk about what would happen on the 24th if one of your parents needed to have care. What would that mean to you if you had to quit your job or take extended time off? How that could impact you. So make sure that you continue to pay attention to those webinars. We've got a lot of stuff, and then Chanson and Tony will come in and share some of the latest legislative issues and ways you can advocate on your behalf. But tell your coworkers about this webinar series. This is a great way to introduce them to OPEA. Let them hear what legislative issues could impact them about pay, benefits, work issues, things like that. So many things that Tony and Chanson talk about directly impact them. Why not let them know what's going on, and maybe they'll join OPEA as well, so that when it comes time for elections or legislative issues, we've got a pretty strong voice, several thousand more members that can talk about what OPEA stands for. All right, I'm going to pause this conversation right here, see if there's any questions out there. Feel free to drop it into chat, drop it into Q&A, and we'll take care of all of that, and we'll answer those questions for you. If it's something that David thinks the group needs to hear, we'll do that. You can always check out your benefits on OPEA, see what you have available. But if you want to find out about MASA, if you want to find out about Passport, those two things we talked about today, take your smartphone, hover over that QR code with your camera. So turn your camera on, hover over it, a little form will pop up. You can check MASA, you can check Review My Benefits. David and his team, Mandy, anybody in the state will give you a shout and say, hey, here's what you wanted to know, walk you through everything. If you're on an iPad or on your phone and you can't use the QR code, you can simply email me there at john.green@amba.info. It's JON.green@amba.info. And I'll be glad to get you in contact with David and his team, Mandy, and any other one that's out there that can take care of you that way. So I'm going to stop recording here. And if you've got any questions,